Here's a sneak peek of Whiteside Tactical Solution TECC event led by Dr. Derek Whiteside, our medical director. In this video, he's explaining and providing hands-on demonstration for both adult and pediatric CPR AED. 4 of the 7 participants earned the American Heart Association Basic Life Support, also known as BLS Provider Certification.
There's the encircling thumb technique, so where you actually go up on the ribs, and so you have your hands around the child, and the thumbs are encircling, similar to an adult, where your palm of your hand is here, your thumbs are right here. Same thing. And you're doing this, you're squeezing, okay? Same thing. The other thing, which has fallen out of favor, but people still do it, it's harder to hold the child to 2-finger technique. It doesn't work as well because 1, your fingers are not strong, 2, you're not gonna be consistent, and 3, nobody does it right. Even trained professionals do not do it right. But you can do 2 fingers, center of the chest, and apply pressure. That will wear you down. 2 fingers, apply pressure. You're doing it, you're seeing it. Same thing though. I'm looking and I'm feeling, listening, looking for rise and fall of the chest. That's what you're doing. Most of the time when a child stops breathing, it's because they put stuff in their mouth. So you want to look to see if their airway is open or not. If you don't feel a pulse, you already know the baby's not breathing, it has no pulse, it now needs CPR. So for a child, there's 2 ways you can do it. There's the encircling thumb technique, so where you actually go up on the ribs, and so you have your hands around the child, and the thumbs are encircling, similar to an adult, where your palm of your hand is here, your thumbs are right here. Same thing. And you're doing this, you're squeezing, okay? Same thing. The other thing, which has fallen out of favor, but people still do it, it's harder to hold the child to 2-finger technique. It doesn't work as well because 1, your fingers are not strong, 2, you're not gonna be consistent, and 3, nobody does it right. Even trained professionals do not do it right. But you can do 2 fingers, center of the chest, and apply pressure. That will wear you down. You can do it if the child's on the ground. I always say encircling technique, you got a better grip, and then you can get better squeeze, okay? And you're still doing child 30 and 2 for a child as well. It's still the same. Don't worry about breaking ribs on the child because it's not fully formed. They're more pliable, more mushy, so it's just gonna move with you, so it's definitely okay. Ventilation is the same thing. Same way with ventilation except for a child. Their airway goes straight down. So you still put it on them. You can do the EC technique, but you don't have to hyperextend the neck. If you hyperextend the neck, you actually occlude the airway. You block it off. You keep it straight because the airway goes straight up and down. And then literally squeeze and squeeze. You don't have to squeeze all the air out the bag because you're overinflating the chest. Then you'll have a whole nother issue. Just as simple, squeeze. You're squeezing hard enough to see the chest rise, fall. Simple squeeze, squeeze. All this time, you're freaking out. Your adrenaline's gonna be pumping. Breathe. As I always say, breathe, take a deep breath, because you wanna make sure you help the child, so you have to have clear thoughts. So 30 and 2, 30 compressions, 2 breaths. AED's the same thing. You get your AED. A lot of people, I'm one of them by habit, and I've been doing it for so long, I plug it in, I put the pads on, then I turn it on. Honestly, you want to grab it, turn it on, plug it in, put the pads on. But as long as you remember, you have to turn it on. So I tell everybody, just turn it on at the beginning. That way don't forget anything, and this is going to talk to you. Okay? But right now, for the adult only, you have pictures on here. You see what the pictures are? I tell you, the AED's dummy proof. It'll tell you what to do. So let's say somebody finally came back with your AED. Great, I have my AED. It should walk me through.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Do they come with razors?
Yes. They come. You have a whole kit. Well, normally I'm gonna say
apply pads. Plug in connector.
They come with a razor because you're gonna have hairy man.
Analyzing heart rhythm.
So that's what I like. Yeah. It's telling you what to do.
And if you need to cut it off,
shake it. Yeah, shake it. You don't have pads to whack them. Yeah. No, really. That's why I just say take it. So you hear it told me shock advice. When it tells you shock advice, it's going to charge. I'm looking around.
Stay
it sounds
clear
crazy,
of the patient.
but I'm saying I'm clear, you're clear, everybody clear, because you don't want somebody to get electricity with it. Clear, shocking.
Shock delivered.
Shock is delivered. Let me see if it's going to tell me.
Begin CPR.
And now it has a beep, and that's your rhythm right there. That's literally your rhythm. And when you're doing two-man CPR, no, one-man CPR is 30 to 2, two-man CPR is what?
15 to 2.
Good job, 15 to 2. And why the difference in because you have two people now.
So you don't get so
Yeah, so you have two people, one to do, when it's by yourself, you gotta have more blood flowing through, then you get the rest. But they going now where you're doing hands-on CPR, because a lot of people are like, well, I don't want to touch them. And they found it just as effective. I would say just as effective, because again, you're circulating the air for the oxygen around. So just that thing count all the way to the whole.
You understand that? Like I said, you have the pediatric, shows the same way. Front, back. You have the adults, same thing, front, back. Do not cut down the size of the pads for a pediatric, because you'll mess up everything. Front, back, apply. You're not going to fry the kid. You are not. The machine will know how much it needs to deliver. It's going to deliver it. The child will be fine. I would rather you do everything you can to save a child instead of messing up equipment thinking you're doing them a favor.
So the size of the pads don't have to determine the amount of electricity. It's just handle it.
It's built inside here.
Yeah, there's one more thing. When it comes to this, because the bystanders, no more thinking. Literally, look at pictures. Like guys, when it comes to building things, that's me. I'm not reading directions. Talk me through it. Okay, boom, boom. That's literally all. That's how it is. And when EMS comes in, like I will roll in, I'm like, hey, what's going on? And I'm like, obviously you see me doing CPR. How long you been doing CPR? Then we just give a rough estimate. And I was like, continue doing CPR. Because you're already doing it, there's no sense of me getting in your way. Continue doing CPR. Let me go ahead and set my equipment up. And I'm telling my partner to get this stuff ready. Then once you're able to pause, I go and step back. We'll take over. Thank you so much. Just stay right there. We might have questions for you. Then we're going to do what we need to do. So we'll keep your pads on. We'll move your pads to the side. Then we put ours on. Some of them are actually where they're interchangeable, so I can actually connect the AED pads into our equipment. So we use it that way.
Deeper. That's what you want right there. That's how deep you push. And you move forward and you push down.
Right. This is a lot of places. Yeah, you're gonna break it. You hear it?
Give me the AED, babe.
Yeah, like that girlfriend anyway. Let her know.
Analyzing heart rhythm. Apply pads to patients. Do not touch the patient. Flashing light.
Turn it on because of the adrenaline.
Do not touch the patient.
What you trying to say?
Stay clear of patient. Shock advised. Deliver shock now. Press the orange charging now. Charging. Clear. Stay clear of patient.
Clear.
Shock. Deliver shock. Deliver shock.
Clear. Everybody clear.
Shock. CPR. Shock. Delivered.
Y'all look good. Except for a doc. Good doc, so we doing them all the time. Grab his chest, flip backwards. His child comes in, says, I don't know what happened. Uncles, something happened with daddy. What's going on? You already know the scene safe. What do you do next? You okay? You okay? All right, you okay? Okay. Now pulse. Same side, 2 fingers on the neck. Then look, listen. AED in the house. What do you tell them to do? So your nephew comes back. He says, Uncle, here's that AED. He took everything apart and dropped it on the ground. Let's say it's been the 30 and 2. Oh, wait. First thing, turn the AED on. Push and hold.
There you go.
Plug-in pads connector.
Clear.
Apply pads.
What's taking so long, Uncle?
Analyzing. Stay clear.
Why we taking forever?
Clear.
Do not touch the patient now. Press the orange button now. Apply pads. Plug shock. Delivered. Shock advised. Stay clear. Begin. Do not shock.
You want to make sure you yourself is clear, because you will feel that electricity, and it will wake you up and knock you down.
Deliver shock now.
Not talking from experience.
Orange button now. Deliver. Stay clear of patient. Shock delivered.
There you go.
Shock CPR. Shock delivered.
Want to learn more from the best of the best? Make sure that you watch our page for our upcoming TECC courses. Also, make sure to follow us on our social media. Social media handles are in the description.